For the record, my name is Stacy Chamberlain, and I am the Executive Director at Oregon AFSCME. And today I'm here testifying for the over 2,000 family and home-based child care providers and local president of child care providers together, Autumn David, who couldn't be here. As you can imagine, this time is really busy for our child care providers.
And Stacy, we can't see you, just in case you did want to turn your video on.
Oh, I see my video on.
Can you all see her? Maybe it's me.
Okay,
perfect. Okay, continue. I'm glad it's just my computer.
Good, because I do not know if I how the capabilities of fixing that. So I'm glad it's working. As you've already heard, the pandemic has taken an unprecedented toll on childcare, and our home care providers were no exception to that. If I was here last year testifying, we would have had an additional 379 child care providers than we do today. And so while I'm here on behalf of our child care providers, I'm also here on behalf of the 30,000 workers Oregon AFSCME represents across the state, from our Oregon State Hospital workers, corrections workers, OHSU employees, families who need care outside of the traditional 9-to-5 schedule, families who need infant and toddler care, and families who are really in search of culturally specific care and accessible to their homes and work sites. Because this is some of the frustrations that I've heard, not just with our child care providers, but from our workers, or especially our 24/7 essential workers all over our state, was they can't even find the child care that they need. So every single day, I've heard about this from at least one member, either providing care or in search of that care. And with AFSCME, our in-home and family-based child care providers represent a little more than about a quarter of the child care capacity in the state of Oregon. But that percentage is much, much higher if you look at the culturally specific care and the non-traditional hours that we provide 24/7, Monday through Friday, weekends, and the care in the rural communities in the infant and toddler care as well. And I'm seeing heads nod too. So you can see this specifically in a report that was done in the spring of 2021. PSU, OSU, and the Early Learning Division released this study. And it was the timing was perfect, right? Because it gave us a really solid look at what was going on. And the study was really loud and clear that the child care crisis comes down to money in a lot of ways. 55% of the child care directors said increasing funding is needed to stay open or reopen. And out of the over 3,000 respondents surveyed, 881 identified as directors of child care. And 64% of those were AFSCME child care providers. A vast majority of these child care providers are women, as you know, 87%. And so when we look at it, we're really thinking about these members and these women as single or as small business owners, right? And making sure that they have the support necessary as small business owners. So many child care directors are also women of color. They speak various languages and are essential to the values that the work that we've been trying to lean into with the type of child care that we know that we need to provide in the state. And then, as you already heard, when COVID-19 hit, the impacts on childcare were astonishing. 43% of our family home-based childcare directors and staff quit during the pandemic. That's almost 50%. 50% of the family and home-based directors had to reduce their staffing hours, providing even less childcare slots for those families in Oregon. And almost 28% of all providers had to temporarily close during COVID due to related problems. And almost 5% of all providers had to close permanently. They haven't been able to reopen. And so providers, as you're hearing, need your help now more than ever. And while they greatly appreciate the over $2 million in stabilization grants that have been provided, that hasn't been nearly enough, right? Because that helped folks open back up, but it hasn't helped us really grow. It stopped the bleeding, but it didn't help take care of the slots that we knew we needed even before the pandemic hit. So we're optimistic that Congress is going to be able to pass a Build Back Better plan that would spend about $4 billion in child care investment in Oregon. And we know this is a massive step forward to fixing the child care problem, and it's going to require Oregon to be prepared from the get-go. And so on behalf of Oregon AFSCME, we're requesting your support in these critical areas. Increasing rates for providers. While many of our directors understand the value of the work their staff provide, many of the directors can only afford to pay their staff minimum wage. Many of others struggle just to keep their business open, and there's other financial barriers that we think that this will help address. We also know we need to build the critical supply back up and getting families the care that they need. And that this can come in a number of ways, but investing in the community-based organizations and culturally specific organizations to immediately recruit and provide the training that we've heard is necessary to those folks, and invest in the existing providers that we currently have to build up the capabilities and the capacity and improve workforce retention. And we think we can do this by creating some one-time expansion and capacity building grants for our current providers. If they know that they're being invested in and there's support and resources, they can actually staff up, hire more staff, and increase their slots. We can work with SEIU, and we're currently working with SEIU and some other community partners like Unite to actually go out and help provide the training and support necessary for their friends and family programs to become certified registered and help grow the programs there as well. So we believe that current stabilization grants have been essential, but they're not enough, and we can do a little bit more. And then focus on the decisions ahead. This work always takes longer than I think any of us would like. And so we're really excited that we're having this conversation now. We're really excited about the leadership and having the important conversations now, because the legislature is going to have to make some significant policy choices down the road to navigate the new federal child care investment. So, and we know we're not ready right now, but this is a great first step, and we're really hopeful with the leadership we're seeing here and in the House to help us navigate these major transformations that we know are so very necessary. So, that brings us to the end of my remarks. These are our big asks for 2022. It's essential that we focus on equity when we're addressing these requests, and that not all Oregonians have access to the care they need and where they need it, whether they're a person of color or in rural parts of the state. And that we know that these investments not only impact the child care providers themselves, but all of the families in Oregon. So I've submitted written testimony as well. So if folks have any questions, I thank you for your time.